Hi everybody, it's Dr. Dunne again, and I'm really excited that you clicked below on neck, back, joint, or arthritis symptoms. So on this little segment, we're going to go over the neck, okay? With neck issues, many times it starts out with a trauma, such as an athletic injury, a concussion, a car wreck or a whiplash, some type of trauma. And that trauma, folks, can also come from childbirth. So there's many different ways that we can start out with neck issues. And over the years, they present themselves with, first time you get pain, you may get migraines, you may get TMJ, and if it progresses, you may have issues that cause numbness and tingling down your arms, pain down your arms. So what are we going to do that's different here at Advocate Integrative Medicine? So we start out with neck pain. We want to take you through a thorough consultation. So we're just not going to look at your neck, we're going to look at your whole body to figure out what is going on. Because if you have an issue in your neck, it may also include your shoulder, it may also include your elbow. So we need to have an all-encompassing, thorough consultation. If we have enough information from your consultation that would warrant an exam, then we move on to the exam. So we do what we call a functional exam. We're going to stress your body, stress your neck in this case in different manners, and that tells us what tissues are involved and what else may be involved, such as rotator cuff or elbow issues. Make sense? So typically it's never just going to be one thing, it's going to be a cascade of things down that upper extremity. If we have enough information from our functional exam, then we're going to move on to functional diagnostic tests. So I have to go through each step, and each step must warrant the next step. Functional diagnostics are standing x-rays, and I may bring your neck down and take an x-ray, and move your neck back and take an x-ray. So the weight of your body standing means that I'm loading the spine, and then bringing your head forwards and backwards means that I'm stressing your spine. And folks, the example that I want you to understand is your heart. If you have heart issues, you may do a stress test. You get on a treadmill, we ramp your heart up, and we stress the heart, and then we measure how it responds to the stress. That makes perfect sense to me that we should do that with all of our diagnostics. So our functional diagnostics are standing x-rays, and or if we do an ultrasound. We may do an ultrasound on your shoulder and then move your shoulder and stress the tendons and ligaments to see how they respond under a load. That, folks, is functional diagnostics. Once we run through these first three things, this is where it really gets different. Number 4 is a team approach. We have medical doctors, nurse practitioners, chiropractors, and technicians that all sit down around the table and we discuss all of your functional diagnostics, your functional exam, and a thorough consultation. All of us together discuss your treatment plan and how we can best serve you as a unit or as a team. No one else does that in healthcare. And quite frankly, folks, where do you get that many opinions for that price? You don't. That's one of the big reasons why we are so different. And then the last reason why we're so different with your particular neck pain is our functional treatment plans. Some folks may benefit from regenerative medicine. Some folks are going to receive medical care, such as trigger point injections, maybe joint injections. Again, depending on what their needs are. Some may need bracing. We may need to brace that neck for a short period of time and unload the spine so that your body can heal. Most folks will receive a specific type of rehabilitation to restore muscle length and muscle strength back to normal functional parameters. And lastly, we have a team of chiropractors that will restore the neural integrity of your spine so that it is functioning right, so that when we do rehab, when we do bracing, when we do regenerative medicine, everything is stacked on top of each other so that you get the maximum benefit from the maximum amount of providers in the shortest amount of time. That's why we're different at Advocate Integrative Medicine. And that's why when you give us an opportunity, we're going to show you just how special we can be. Thank you for tuning in. And just below, I'm going to have another link that you can click on, and you can get a reduced fee examination, which is going to include a consult and an exam at a reduced fee. And let's figure out if our approach can help you with your neck pain. And folks, I do believe that we can help every one of you out there. Click below, give us an opportunity, and let's get this started so that you can have the lifestyle that you're looking for. I'm Dr. Tim Dunne with Advocate Integrative Medicine.